Thank you very much. I will be stating the question as we've got then, and please, if you have anyone from the audience have a question, please just let us know. الله يعطيكم العافية جميعا. Great presentations. And the first question goes to Dr. Al-Ghamdi on regard to the lung transplantation. What is the percentage of lung affected by IPF which is related or which indicated to be a lung transplant?
Yeah. So among the idiopathic pulmonary fibrosis, we'll go over the criteria for referral and the criteria for listing, as they are more important than the percentage of the patient who ultimately needs lung transplant. Such data will be available more with the National Guard Hospital lung transplant physicians and the physicians at the King Faisal Specialty Hospital. I wish that Dr. Raid was still there, or here I mean. He would probably have the answer to that because they receive patients from across the kingdom. So once the patient has idiopathic pulmonary fibrosis, it is appropriate to start the referring process. Due to the limited number of centers in the kingdom, we don't usually do that. So we usually refer the patient for lung transplantation when the actual transplantation is needed. So it is a bit late, but it's because of the limited number of centers that we have. It is not practical to refer all the patients with IPF. So we refer IPF patients once they need oxygen, once they have pulmonary hypertension, at least an echo, once their FVC is less than 50%, or the DLCO is less than 40%. And these are the main criteria to when to refer patients with IPF. IPF patients during follow-up will either die or they will require lung transplantation or continue to have the disease, IPF, I mean, and be ineligible for lung transplantation. So they will hit one of the three during the follow-up. Either they will meet or need lung transplant, they don't need a lung transplant, or they are not eligible for lung transplant. Category 3, they will die during the process. So yeah, it is a large proportion of patients who would require ultimately lung transplantation.
Thank you very much. Dr. Ghada, I'm biased in that presentation. So first of all, thank you very much for the beautiful presentation. Where do you see the presence of the pharmacists and clinical pharmacists in these multidisciplinary teams?
I think it's really important, especially in the beginning, just to make sure that we prescribe the medication appropriately, reviewing any adverse presence of any other comorbidities that will make adverse events more probable. And also in terms of the monitoring of the drug like LFTs and the other markers, and monitoring for adverse events after starting the medication.
Thank you very much. Dr. Mohammed Shabrawishi, is there any prophylactic measure for IPF?
So as we mentioned by all the speakers, I think the risk factor for having IPF is multiple, and unfortunately, not all of them can be controlled. However, one of the controlled is being, or one of the risk factors that can be tackled is the smoking, of course. So maybe smoking and its linkage to the IPF is already confirmed. However, the other risk factor beside the family history is in form of genetic and environmental exposure and so on. So until now, we don't have any guidelines recommending any prophylactic or even screening for idiopathic pulmonary fibrosis.
Thank you very much. Dr. Abdullah Asiri, is there any Saudi national guidelines for IPF?
For a time being, no. But Dr. Mohammed, he started to establish the registry for interstitial lung disease. and hopefully we will have, inshallah, in the near future guidelines regarding the ILD in general and specifically IVF. Hopefully, the near future.
Inshallah. Thank you very much. Because it's very important to standardize the care when it comes to different management from different sectors. Pushing the agenda of clinical trials, and as we've been seeing with multiple presentation today, multiple clinical trials being done in other countries of the world. This is a question for you all. Do you know any clinical trials that is being currently or is coming in the future very soon to Saudi Arabia? And have any of your centers been introduced to such clinical trials?
Yeah, so our center and the National Guard Hospital in Riyadh were approached to participate in the BI 101500 or something very close to that. It's it's a medicine that being investigated. It was a phase 3 trial, both for patients with IPF and patients with progressive pulmonary fibrosis. I'm not 100% certain if the National Guard Hospital have managed to recruit patients. For us at King Fahd Medical City, we were mainly focused on the IPF trial, and the study group have already completed the recruitment before we got into it.
BI, we are going to talk about this, inshallah, next week. Okay, any other comments from in regards to clinical trials? Okay. Any questions from the audience, please? None. Okay. Again, thank you very much for being here today with us. And inshallah, this will be an annual thing. And as I mentioned, we are going to do the burden of IBD in the Kingdom of Saudi Arabia, and you are all welcome to participate in that. Thank you very much.